The way that Colorado helps members to receive the private duty nursing care they need is changing. Soon, nurse assessors will begin conducting virtual and in-home visits using a new assessment tool. Private duty nursing, or PDN, is for individuals with complex medical conditions who require a nurse for more than a traditional nursing visit. Soon, nurse assessors will begin conducting home visits using a new assessment tool to measure a member's complex medical care needs that can only be provided by a private duty nurse. Rest assured that all of your needs will be carefully considered, and the nurse assessor will ensure they're addressed using the appropriate tools to provide the best support possible. As you watch this video, please know that the nurse assessors will be willing and able to answer many of your questions regarding this change. Overview of the assessment and the PDN tool. The Private Duty Nursing, or the PDN tool, was designed to determine the needs of individuals with complex medical conditions who require a nurse for more than a traditional nursing visit in the community setting. The tool, which was determined to be valid and reliable, will be completed by a registered nurse in the presence of the member and their family. Moving forward, the registered nurse completing the tool may also be referred to as a nurse assessor. The time needed to complete the tool may vary. However, the PDN tool was designed to be completed in one visit. The purpose of this new tool is so that all members have an opportunity to have consistency and efficiency in the way that their PDN hours are determined. During the assessment, you can have anyone present with you, including family, a friend, a medical provider who is familiar with your care, an advocate, or a case manager. The tool has 8 areas that are focused on basic demographic information, skilled nursing interventions for each body system, including hands-on tasks and skilled assessments, and considers factors such as the ability to communicate and levels of cooperation with skilled nursing interventions. The assessment tool factors in how well the member can communicate, including if they can understand what others are saying to them, and how much they can cooperate with hands-on tasks and skilled nursing interventions. Skilled nursing interventions are defined as hands-on tasks and skilled assessments that require the skills of a licensed nurse to perform the member's care. The nurse assessor will use the tool to assess whether each intervention requires the skills of a licensed nurse for the member's unique needs, including whether the member can safely perform the skills independently. As mentioned before, the tool will also be used to assess the needs for tasks that can only be performed by a licensed nurse. The tasks for a licensed nurse can include many skills and interventions, such as ventilator or tracheostomy care, tube feedings, titrated oxygen, catheter care, wound care, foot care, blood draws, IV medications, medication setups, and insulin pump management. While every task that a PDN can do was not listed, the tool allows for a holistic assessment of the member's unique needs and interventions. Rating and scoring the assessment. Using the tool, the nurse assessor will indicate how much assistance is needed for each intervention to be completed. Because each member's care is so different, the tool allows for a range of abilities to be factored in the holistic assessment. For example, for the intervention of oxygen, the nurse assessor can document if the member requires oxygen at the same rate continuously, or if the nurse must assess and titrate the member's oxygen throughout the shift. To prepare for the visit, please make sure that you are able to share any medical documentation, such as nursing notes from previous services, notes from recent medical appointments or therapy visits, letters from physicians or treating clinicians that describe your needs, notes on how the member can complete activities of daily living with or without assistance, doctor's notes, and school health services documentation, if applicable, with the nurse assessor. Also, please be sure to have your questions ready. The nurse assessors will be happy to help you get your questions answered during the assessment or shortly afterwards. Upon completion of the PDN and LTHH tools, the nurse assessor will review the results with you and discuss next steps.